According to the 2022 index of the Heritage Foundation, Japan's economy is the 35th greatest in the world. Within this country, people are ranked in social standings based on their income, education, and occupation, also known as socioeconomic status, or SES. According to the Resilience Among Haitians in the John Hopkins University Press, these rankings may cause psychological changes or irreversible health and social outcomes. Based on this, the question must be asked: to what extent does socioeconomic status influence have on health behaviors in Japan for the past decade? Socioeconomic status has a major influence on health behaviors. More importantly, low socioeconomic status. Low socioeconomic status decreases general health over millions of families in Japan, more specifically mental and physical health and generational attributes. This can be solved with more aid from the United States within charity organizations or funds. The first impact of low socioeconomic status is mental stability and happiness. As we can see within the chart, those with middle and higher levels of socioeconomic status are less likely to engage in substances and more likely to have good dietary habits. More importantly, those with depression and other disorders are less likely, are on the other side of the spectrum of this. Study states that participants who were married with high levels of education and with high levels of SES had higher odds of belonging to the low substance use and good dietary habit cluster. But moreover, those with depression and other disorders were less likely to be within this cluster. Happiness is a key factor to well-being, productivity, and quality of life. These factors can significantly reduce if people live in more impoverished communities. Low socioeconomic status can actually induce mental disorder, also known as social causation. Those with high substance use or poor diets are more likely to develop MD, otherwise known as major depression, and generalized anxiety disorder. Secondly, low socioeconomic status can have a physical impact. As you can see within the chart, and according to Sugisawa, there was a relationship found between socioeconomic status and two health behaviors, with a significant influence on both exercise participation and smoking status. He agrees with this, saying consequences of smoking or not engaging in exercise can have lifelong impacts that can reduce one's well-being immensely. And as the pattern continues, we can clearly state that low socioeconomic status can increase smoking and reduce exercise participation. Eric Bender in the Urban Evolution from Noble Magazine states, impoverished neighborhoods and communities have greater exposure to pollutants and other environmental disadvantages, such as disease and underlying conditions. Therefore, again, the pattern continues as people living with low socioeconomic status are extremely more susceptible to poor health and can have a physical consequence that can last a lifetime. Finally, the last effect of low socioeconomic status is parental influence or generational attributes. Okamoto says, adolescent in the middle or high income groups tended to report better health status compared to the low income group, have a higher frequency of having breakfast, and more likely to regularly brush their teeth by 24%. He adds on to this by saying parental education was also related to child health related behaviors, with higher levels of healthy behaviors being observed in high and middle education by 15% compared to those in the lower class. This displays how families living in higher socioeconomic status are more comfortable and have more accessibility to health behaviors. So in conclusion, socioeconomic status heavily impacts the health and lifestyle citizens living. So some solutions could be the US aid and citizen organizations, like charity. The US government already has funds for other countries. We can allocate a certain amount to Japan specifically, since it's so prevalent among so many families in Japan. Some limitations, obviously Japan can decline these donations. And if we do set up this system, these citizens rely heavily on these donations and how much people in the US specifically donate. And as the years go by, donations will more than likely drop. So they will have to rely on a very little amount, and the problem will probably come back again.
All right, 2 questions for you.
Okay.
First up, how valid and reliable are the sources that you use, and then how do you know?
I think they're extremely reliable only because of the authors that wrote them. they're mostly researchers and professors at certain universities in Japan.
All right, and what additional questions emerged as you were going through your research?
I felt like there wasn't enough connection between really socioeconomic status and physical health specifically. So I tried to think of other perspectives that could go along with it, but I thought this fit the